Both healthy and unhealthy behaviors established during adolescence can continue to influence health well into adulthood. The risks associated with youth substance use can be acute, including intentional or unintentional injuries, physical violence, accidents, or poisonings, or they can be chronic, leading to poor academic performance, addiction, relationship problems, disease, and so forth. About 90% of individuals diagnosed with substance dependence started using substances before the age of 18 years. The earlier the age of onset of use, the higher the risk for substance use issues later in life. In Canada, the average age for alcohol onset is 13.4 years.
The questionnaires that we use, they're not asking only how much you drink or smoke or things like that, but we ask about everything in the environment of children. We ask about their connection with family, friends, their leisure activities, everything that really matters in the life of a child. And this we need in order to be able to find the local risk and protective factors, what needs to be addressed in this local area. We could see, the people working in the field, from the data, that there were certain factors connected with if children started to use drugs or not. So that was what we called the risk and protective factors.
Now, often when we focus on individual behaviors, especially negative ones like youth substance use, we get stuck in just talking about that behavior and how can we have less of it? And then our focus stays really narrow. But the Icelandic model gives us a chance to be motivated by that behavior, but then shift our focus to the conditions that shape it. And then by focusing on these conditions, we can have an impact on so many other things. The behavior becomes our starting point, our check-in, but the initiative really becomes about building community. And it's much more energizing to be moving towards something positive than away from something negative.
But again, this is a community-based approach. This doesn't fall to the schools. This is not the responsibility of the schools. I can speak from experience in the United States. Our schools often feel like when there's something going on with youth that they're held responsible, and it shouldn't be the case. It's a community thing. You have a lot of stakeholders that want to work toward youth health and well-being, and you just need to make that known. So something to mention is this survey is so great because you get the data back in 6 weeks. You know what's happening with your young people right now. And I know that's not typical of a lot of surveys and a lot of data. It was so useful for us in Vermont when our survey was done in September, and then before the end of the year, we had that data back and we could go into the communities and talk about it and create goals and strategies.
Preventing early substance use isn't the job of any one parent, any one school, or any one organization. We are all collectively part of the solution. It does take a community. We can all make changes, and when we work together in a coordinated approach, we will have greater impact and success than we ever would have alone.